Welcome to another Brush Up on Bob. I'm Bob, and today we're going to be talking about the three musketeers of pain relief. What I'm talking about is acetylsalicylic acid, aspirin, acetaminophen, also known as Tylenol, and NSAIDs, non-steroidal anti-inflammatory drugs. Specifically, we're going to be talking about drugs like Ibuprofen and Motrin. And what we're also going to learn about today is how the prostate gland deals with pain management, how OTC meds, should they be combined or separate, and the difference between aspirin, NSAIDs, and acetaminophen. Are they the same or are they different? So stay tuned, and we're going to talk about this today on Brush Up on Bob. So how does the prostate gland deal with pain management? Well, let me tell you. Back in the 1900s, there was a scientist who studied seminal fluid, and he found this unknown compound. And this unknown compound, being as he thought it was from the prostate gland, well, hence he called it a prostaglandin. And the IN, we know on any type of medical terminology, means pertaining to. So pertaining to, coming from the prostate gland. So hence today, when we talk about prostaglandins inside the body, which is a hormone that is released, we're talking about prostaglandins, okay? But it's not coming from just the prostate gland. It also comes from the gastrointestinal tract. It comes from the skin. It comes from different areas of the body, and prostaglandins are a hormone that's released. Now, what releases this hormone is an enzyme, and this enzyme we call cyclooxygenase, and this cyclooxygenase enzyme releases this prostaglandin hormone. Now, when we inhibit cyclooxygenase, we inhibit the prostaglandin release, thus we can release a medication into the body to release an effect. Okay, and specifically what we're talking about today is pain management. And so what we are releasing is the release of that euphoric feeling of when you don't have any pain. Now, these medications that are inhibiting prostaglandin release are actually making you feel better. And prostaglandins, most of them have kind of a negative connotation to them, but they all have, things that they are important duties inside the body. But with this certain prostaglandin that we are inhibiting, we are getting that pain management that we need, specifically from non-steroidal anti-inflammatory drugs, acetaminophen and acetylsalicylic acid. Okay, now let's talk about the difference between those three medications. So what are the three again? Well, we're talking about acetaminophen, acetylsalicylic acid, and non-steroidal anti-inflammatory drugs. So let's start out with acetaminophen. Acetaminophen, also called Tylenol, and other names that are out there for brands that are non-regulated for what they can call them, because the FDA has really no hold over over-the-counter medications, so OTC meds. So Tylenol, we inhibit the prostaglandin synthesis. Now, we've already talked about prostaglandins. Now, what effects does Tylenol have? It has analgesic effects, so we're affecting pain. We're inhibiting the pain receptors. So we have some pain relief. Antipyretic effects, so we're going to decrease the fever. But really, Tylenol has no anti-inflammatory effects. When you do have Tylenol that has some of those anti-inflammatory effects, they're adding another type of medication to that acetaminophen. Okay? Now, the benefits of Tylenol, the main ones that I want you to take away today is there's no really abdominal upset. So people with gastrointestinal disorders like ulcers, and they frequently have acid reflux and stuff like that, it's going to have no abdominal upset. So they're going to have better pain relief and less abdominal upset from taking these medications that are over the counter. Children can also use Tylenol. So you also find children's Tylenol in the store. And you're going to find in oral solutions, you're going to find in tablets, gel capsules, various other types of substances that Tylenol can come in, and we're talking about acetaminophen across the board. Your generics are going to be probably your best option for buying this if you want to save money. So when we talk about acetaminophen, we're talking about pain relief and fever reduction, but really no anti-inflammatory. So the big one I want you to take away, when you think acetaminophen, I want you to think fever reduction. That's the big thing that Tylenol, acetaminophen, does. Acetylsalicylic acid, which we talk about when we talk about aspirin, Its inhibition of the prostaglandin synthesis is both for the central nervous system and the periphery. Okay, and its main things that aspirin does is pain relief, fever reduction, preventing clotting, specifically with the platelets, and anti-inflammatory, which when we talk about anti-inflammatory, we're reducing inflammation, redness, heat, and swelling. And the big one I want you to take away for aspirin is that it inhibits platelet aggregation. So as some people call the slickum med. So most people take aspirin for a AMI that is actually occurring, or that they had one in the past, and so they're trying to keep from a reoccurrence. They also take aspirin for rheumatoid arthritis. So when we talk about aspirin, we're more or less talking about antiplatelet. So sometimes you'll see combos between aspirin and Tylenol, so you get that anti-inflammatory response with Tylenol, but it's not Tylenol that's doing the anti-inflammatory, it's aspirin. Okay, so non-steroidal anti-inflammatory drugs, when we talk about those, a brand name you might see is Ibuprofen. Okay, so these drugs, their big thing is anti-inflammatory. So if you have some type of inflammation from a fall, and you have inflammation in your ankle, your arm, maybe on the inside from an allergic reaction you had, now you have some inflammation, you want to take this medication because it decreases inflammation. Again, we're inhibiting prostaglandin synthesis by actually inhibiting cyclooxygenase. So they're working on the enzyme this time, which then decreases the prostaglandin synthesis. Again, you'll have pain relief, you'll have fever reduction, and anti-inflammatory effects. NSAIDs are not the super drug, and so you're not going to just have all these wonderful effects. You also have some side effects, so you will, again, like aspirin, can cause some gastric upset, some acid reflux, cause ulcers, depending on long-term usage. If you start taking these medications over a long period of time, you need to go in and get seen. These are not cure-alls, because there may be a bigger problem going on, and what you're doing is just masking the problem. So what I want you to take away from NSAIDs is they are an anti-inflammatory drug. Okay, the final thing I want to cover with you today is the fact that should these over-the-counter meds, should they be combined or separate? Now, depending on what you're needing, if you're needing several different effects, like you're needing some anti-inflammatory, and you're also needing big fever reduction, maybe there is a combination out there. I'm not telling you whether you should or should not. But one thing I do want to put across to you is you can alternate ibuprofen and Tylenol. So if you're taking the ibuprofen, you can also alternate in between. So because the hours, you may not be able to take another ibuprofen for another 6 hours. So you could alternate and take a Tylenol if your pain comes back. Another thing that I want to point out is that combining meds does not mean the med is better or worse than another one. And depending on how much the med is, how much it says, it may say that it's a greater strength. That doesn't mean that greater strength has the same effects that we want. We know that we need to reach that therapeutic level. And just because it has more medication in it doesn't mean it's going to reach that therapeutic level any better than a medication that has less. What we're trying to reach is that pain relief. We're not trying to reach the idea that, if one is good, four is better. So we don't want to get into that mindset. So when it comes to over-the-counter meds, talk to your pharmacist, talk to your doctor, make sure that you know what you're doing. Don't just Google it and think that you have the wherewithal to know what medication is good for you and what is not. Also, be very leery of taking these meds for an extended period of time. If you are, you need to get into the hospital and get seen. So when we talk about over-the-counter meds, they are still medications just like prescription meds. They just are in a less of dosage than the prescription med. Just like ibuprofen, you can get in a 200 milligram tablet, but with a prescription, you can get it from a pharmacy from behind the counter in higher strengths, 400, 500, 600 milligram tablets. Okay, so OTC meds more or less should be separate when you take these medications, because they're going to have a better affinity in your system. They're going to do a better job, and just use them singly and just put those in instead of using the combined forms just because you're lazy and you don't want to have to do the work. All right, well, that's been Brush Up on Bob today with EMS. We talked about the various different types of meds, acetaminophen, NSAIDs, and aspirin. We talked about those, understanding the differences. We know that where pain management does not come from the prostate gland, but that's why we call it prostaglandins. And we understood that OTC meds should not be combined. They more or less should be separate. So I hope this was helpful to you, and remember the 3 Musketeers of pain relief.